steroid injections. Millions of people all over the world experience low back pain. For many of them, this will tend to pass on its own or respond very well to a regimen of rest, exercise, and over-the-counter pain relievers. But, unfortunately for others, it becomes more complicated than that. When the symptoms do not readily respond to conservative treatments and persist for over 3 months, it can be classified as chronic pain. This is actually not a well understood phenomenon yet, and it causes and the experience of each individual will vary greatly. But what is certain is it affects the sufferer's quality of life. It may range from being as simple as an everyday annoyance to an interruption of normal activities, and sometimes can even be as crippling as permanent disability. Thankfully, an epidural steroid pain injection is now an accessible option for many. Generally, however, before a person can be considered for an epidural steroid injection, they must first go through several stages of conservative treatment or pain management. The first recommendation healthcare professionals make is typically the use of a medication along with lifestyle changes to manage pain. Finding the right medications for a pain patient can often be somewhat of a trial and error process, with the specific prescription being changed several times or increased in dosage. If this approach does not prove to be effective, physical therapy and exercises are usually added to the treatment plan. Eventually, if the patient still does not recover satisfactorily, this is when the option of getting an epidural steroid pain injection is introduced. This procedure is not suitable for every case, but can be recommended based on a doctor's judgment of the sources of the patient's back pain. An epidural pain injection is a procedure done by a physician where corticosteroids, or anti-inflammatory medication, is injected into the epidural space. This is the space right outside the dura mater layer of the spinal cord's protective membrane. Usually, the corticosteroids are combined with anesthetics in the injected solution. There are several ways to perform the injection and a few locations to focus on in the spine, but the goal is basically the same. The entire procedure typically takes only 15 minutes to perform, and the patient is usually allowed to go home on the same day. Corticosteroids are powerful anti-inflammatory medication. They are used in an epidural steroid pain injection because pain is often a result of injuries or diseases that promote inflammation. Therefore, the patients that are most likely to benefit from these injections are those whose pain is from inflammatory causes. Some examples of these are conditions that affect the discs located in between the vertebrae of the spine, such as degenerative disc disease or herniated discs. Intervertebral discs are important structures for maintaining stability and flexibility. Ideally, they are very strong, with a tough collagenous outer layer and a softer, well-hydrated core. For people with the above-mentioned conditions, these spinal discs can wear out more easily and become dry and stiff. This is known as desiccation. The edges of the disc may also bulge out of proportion, or the inner core may herniate through the outside. Both of these can be painful and result in the compression of nerves in the proximity. That repeated stress and irritation of the nerves will likely result in painful inflammation in the area, and that is what an epidural steroid pain injection aims to address. Another condition that irritates or compresses nerves is called spinal stenosis. Because it causes pain through the same mechanism of compression and inflammation, an epidural steroid pain injection can also help in the same way. Although it does not involve the intervertebral discs, spinal stenosis can cause similar symptoms through the narrowing of the spinal canal where nerves pass through. This narrowing is usually due to extra bone growth called spurs, or the thickening of ligaments around the canal. It can occur anywhere throughout the spine, but is most common in the neck and lower back. People who suffer from spinal stenosis may experience varying degrees of pain, numbness, weakness, and have difficulty doing certain motions. When the affected nerve is specifically one that goes down either one of the patient's legs, the resulting pain and related symptoms are called sciatica. That is not a disease in itself, but rather a term for the collection of symptoms affecting the lower back, buttocks, legs, and even the feet and toes. It can be caused by any of the conditions described above, or less commonly, by a tight muscle. In some cases, a cause may not even be identified, but the common principle behind the recommended treatment remains the same. The use of an epidural steroid pain injection is considered because the goal is to reduce the painful inflammation of an irritated or pinched nerve. When choosing the treatment pathway, it is a good idea to have a positive outlook, but it is also important to recognize that its success is not guaranteed. Many people do experience some pain relief, but it tends to be temporary. Some may opt to receive the injections more than once. The number of injections still considered safe for minimizing side effects is up to 4 times in 1 year. If the first 1 or 2 injections fail to relieve symptoms, however, it is unlikely that future repetitions will help. It must also be kept in mind that the underlying condition does not normally disappear even if the pain level felt does. Despite these facts, the use of an epidural steroid pain injection remains a valuable option for managing pain. Pain that affects the legs more than the low back is what responds the most positively to this method. For some people, they may not feel a difference in their back, but their leg pain can disappear completely. The real benefit of this pain relief, despite the temporary nature, is the effect it has on the patient's mental and emotional state, as well as their quality of life. The reduction in pain may allow them to successfully participate in physical therapy. Allowing even just a brief reprieve from the pain can help break the negative cycle and begin the body's own healing. Another benefit may be the ability to delay or even forego riskier and more invasive surgical procedures.